There is a growing health crisis in this country, and it's affecting 1 in 3 teens. Joining us to talk about the alarming increase in pre-diabetes is Dr. Fab Mancini, healthy living expert and international best-selling author of the book Self-Health. Good to have you with us.
Thank you so much for having me.
So, Dr. Fab, here in the South, we have an epidemic of obesity. A lot of young people, children, are overweight. And so their risk of pre-diabetes and diabetes is certainly much higher than in other populations. Can you talk a little bit about sort of set the stage for us as what we're looking at these days?
You know, it's interesting because we're living in a time that we have recognized that in the United States, 90% of the healthcare costs is chronic disease. Diabetes being one of the largest ones, and it's over 80% of Americans are overweight or obese. But now we look at our children, and it's 40% of our children now are overweight and obese, which leads to the CDC announcing recently that 1 out of 3 teenagers are actually pre-diabetic. And that's a big concern, as you know, because diabetes is a precursor for not only heart disease, but also cancer and many others.
Indeed. And we're looking at highly processed foods, a lot of fast food. So those are obvious reasons why these children are finding themselves in this predicament. But maybe you can tell us a little bit more about why we're seeing such a shift in our young population suffering from prediabetes.
Well, we've known for years that we have what we call in science a sedentary syndrome, which our children are spending about 9 hours a day on their phones. So they're not moving, they're not walking, they're not running, they're not exercising. But the biggest culprit that the science has shown us is actually sugar. And sugar is actually embedded in most of the snacks and most of the foods that our teenagers are actually having. And that has actually contributed a great deal. Because we don't see it. In fact, we celebrate it, right? We go have an ice cream whenever we win a game, or we go celebrate with a cake or something like that. And that's what we're trying to bring attention to, is pay attention to the foods that you have, and hopefully reduce the sugar in your teenagers or your family's food. And if you want to have any sweets, then you can find the same natural sugars in fruits. And that's what we're trying to encourage people to consider as a substitute.
Yeah, you say that many children are having doubling their sugar intake before lunch even, which is just mind-blowing to me. Why is prediabetes, though, overlooked by healthcare providers? Why is this not getting diagnosed sooner?
Well, I don't think it's necessarily being undiagnosed, because there's a lot of emphasis right now in evaluating why our children are so sick. So when it comes to our obesity and pre-obesity, I think what's important is there's a new rise of functional health, where we can actually measure a lot of the blood and markers that can dictate whether some child is developing prediabetes early on, before even the symptoms show. But we live in a healthcare system that most people don't go to a doctor until they're already inflamed, until they're already overweight, until they already have, you know, high blood pressure, et cetera, or high cholesterol. So we need to get a little bit more proactive. That will change and that will increase. And also, doctors are now moving more towards asking what is causing this in the first place, and being able to educate their patients into trying to find out what are those things that have already been identified as increasing the obesity and pre-diabetic problem that we have in America.
Yeah, and how do parents have this conversation with their kids? And what are some of the signs that your child is not as healthy as they should be?
Well, some of the signs that we see is that they get inflamed, right? Your child will tell you, Mom, I feel like not only my hands are inflamed, my feet are inflamed, but also my body. The other one is they get a lot of correlations now with obesity and brain fog and cognitive decline. So a lot of times they say, I can't focus, Mom, or I'm very tired, your energy levels drop. So those are the typical signs. So I would suggest primarily just teach your children with you to read labels, and try to stay away from the sucrose and fructose and all the those things that we find in our foods. And also make sure that when you're having breakfast, try to stay away from all the sugary things and bring in maybe an omelet or an egg or fruit or something like that so they have a healthier, more organic breakfast. And also a big one is replacing sodas and fruit juices with filtered water. And lastly, be an example. As a parent, I always say, invite your children to cook with you so that way they can get used to how to prepare a meal healthy. Or if you're going to go for a walk with them, invite them to go for a ride on a bicycle, etc. Engage them into a physical activity so that way they feel like they can get away from some of the video games and also
Absolutely.
all of that cellular activity that
It's a
they're
good
having.
way, and it's a good way to bond. Dr. Fab Mancini, thank you so much for joining us.
Thank you.
We'll be back after this.